Okay, this is the ATI Maternal Newborn, Chapter 23, Newborn Assessment. Understanding physiologic responses of a newborn to birth and physical assessment findings are imperative for providing nursing care following the birth of a newborn. Key areas to know about include APGAR scoring, physical examination of the newborn, New Ballard score, which is gestational age assessment, normal newborn vital signs and measurements, classifications of a newborn by gestational age and weight, diagnostic and therapeutic procedures, and complications of a newborn. Physiologic response of newborn to birth. Adjustments to extrauterine life occur as a newborn's respiratory and circulatory systems are required to rapidly adjust to life outside the uterus. The establishment of respiratory function with the cutting of the umbilical cord is the most critical extrauterine adjustment as the air inflates the lungs with the first breath. Circulatory changes occur due to changes in pressures of the cardiovascular system related to cutting the umbilical cord as a newborn begins breathing independently. The three shunts, ductus arteriosus, ductus venosus, and foramen ovale, functionally close during a newborn's transition to extrauterine life with the flow of oxygenated blood in the lungs and readjustment of atrial blood pressure in the heart. Physical assessment of newborn following birth. APGAR scoring and a brief physical exam is done immediately following birth to rule out abnormalities. Equipment for newborn assessment. Bulb syringe, used for suctioning excess mucus from the mouth and nose. Stethoscope with a pediatric head, used to evaluate heart rate, breath sounds, and bowel sounds. Auxiliary thermometer, used to monitor temperature and prevent hypothermia. Rectal temperatures are avoided because they can injure the delicate rectal mucosa. Blood pressure cuff, electronic method. Blood pressure can be done in all four extremities if evaluating the newborn for suspected cardiac problems. Scale with protective cover in place. Scale should be at 0. Weight should include pounds, ounces, and grams. Tape measure in centimeters. Measure from crown to heel of foot for length. Measure head circumference at greatest diameter, which is occipital to frontal. Measure chest circumference beginning at the nipple line and abdominal circumference above the umbilicus. Clean gloves, worn for all physical assessments until discharge. Initial assessment. Perform a quick initial assessment to review the newborn systems and to observe for life-threatening abnormalities and respiratory issues. External assessment. Skin color, peeling, birthmarks, foot creases, breast tissue, nasal patency, and meconium staining can indicate fetal hypoxia. Chest, point of maximal impulse location, ease of breathing, auscultation for heart rate and quality of tones, and respirations for crackles, wheezes, and equality of bilateral breath sounds. Abdomen, rounded abdomen and umbilical cord with one vein and two arteries. Neurologic, muscle tone and reflex reaction, Moro reflex, palpation for the presence and size of fontanelles and sutures, assessment of fontanelles for fullness or bulge. Other observations, inspection for growth, structural malformations. Expected reference ranges, weight, 5.5 to 8.8 pounds. Normal variation is 6 to 9 pounds. Length, 18 to 22 inches. Head circumference, 12.6 to 14.5 inches. Chest circumference, 12 to 13 inches. Gestational age assessment. A gestational age assessment is performed on newborns within the first 48 hours following birth. Neonatal morbidity and mortality are related to gestational age and birth weight. The gestational age assessment involves taking measurements of the newborn and the use of the New Ballard score. This score provides an estimation of gestational age and a baseline to assess growth and development. New Ballard score, a newborn maturity rating score used to assess neuromuscular and physical maturity. Each individual assessment parameter displays at least 6 ranges of development along a continuum. Each range of development within an assessment is assigned a number value, -1 to 5. The totals are added to give a maturity rating in weeks gestation. For example, a score of 35 indicates 38 weeks of gestation. Neuromuscular maturity. Posture ranging from fully extended to fully flexed is 0 to 4. Square window formation with the neonate's wrist is -1 to 4. Arm recoil where the neonate's arm is passively extended and spontaneously returns to flexion is 0 to 4. Physical maturity. Skin texture ranging from sticky to transparent to leathery, cracked, and wrinkled. That's a range of -1 to 5. Breast tissue amount ranging from imperceptible to full areolar with a 5 to 10 millimeter bud is -1 to 4. And genitalia development ranging from flat, smooth scrotum to pendulous testes with deep reggae for males, and prominent clitoris with flat labia to the labia majora covering the labia minora and clitoris for females. And that's all -1 to 4. Classification. Following physical assessment, classification of the newborn by gestational age and birth weight is determined. Appropriate for gestational age is AGA, and that is weight is between the 10th and 90th percentile. Small for gestational age, which is SGA, is weight is less than the 10th percentile. Large for gestational age, which is LGA, weight is greater than 90th percentile. Low birth weight is LBW. This is the weight of 2,500 grams or less at birth. Intrauterine growth restriction is IUGR, which is growth rate does not meet expectation norms. Early term is defined as occurring from 37 weeks to 38 weeks. Full term is defined as occurring from 39 through 40, and late term is determined as occurring from 41 to 41 weeks, 6 days. Preterm or premature, born prior to 37 weeks of gestation. Late term is defined as occurring 34 weeks to 36 weeks, 7 days. Post-term or post-date, born after the completion of 42 weeks gestation, and post-mature is born after the completion of 42 weeks of gestation with evidence of placental insufficiency. Vital signs are checked in the following sequence: respirations, heart rate, blood pressure, and temperature. The nurse observes the respiration rate first before the newborn becomes active or agitated by use of the stethoscope, thermometer, and/or blood pressure cuff. Normal respiratory rate varies from 30 to 60 breaths a minute with short periods of apnea. This is less than 15 seconds, occurring most frequently during the rapid eye movement sleep cycle. Periods of apnea lasting longer than 15 seconds should be evaluated. Crackles and wheezings are manifestations of fluid or infection in the lungs. Grunting and nasal flaring are clinical findings of respiratory distress. Normal heart rate ranges from 110 to 160 a minute, with brief fluctuations above and below this range depending on activity level, crying or sleeping. Apical pulse rate is assessed for 1 full minute, preferably when the newborn is sleeping. The pediatric stethoscope head is placed on the 4th or 5th intercostal space at the left midclavicular line over the apex of the newborn's heart. Heart murmurs are documented and reported. Normal blood pressure should be 60 to 80, systolic, and 40 to 50 diastolic. Normal temperature range is 97.7 to 99.5, with 98.6 being average. The newborn is at risk for hypothermia and hyperthermia until thermoregulation, which is the ability to produce heat and maintain normal body temperature, stabilizes. If the newborn becomes chilled, cold stress, oxygen demands can increase and acidosis can occur. A more extensive physical exam is performed on a neonate within 24 hours of birth. Vital signs are obtained, a head-to-toe assessment is performed, neurologic and behavioral assessments are completed by eliciting reflexes and observing responses. Laboratory data is monitored. Posture, lying in a curled up position with arms and legs in moderate flexion, resistant to extension of extremities. Skin color should be initially deep red to purple with acrocyanosis, bluish tint to hands and feet. Skin color should fade to a color congruent to the newborn's genetic background. Secondary to increased bilirubin, jaundice can appear on the 3rd day of life, but then decrease spontaneously. Skin turgor should be quick, indicating that the newborn is well hydrated. The skin should spring back immediately when pinched. Texture should be dry, soft, and smooth, showing good hydration. Cracks in hands and feet can be present. In full-term newborns, desquamination, which is peeling, occurs a few days after birth. Vernix caseosa is protective, thick, cheesy covering. Amounts vary, with more present increases in skin folds. Lanugo is fine, downy hair, varies regarding the amount present. It is usually found in the pinnae of ears, forehead, and shoulders. Normal deviations. Milia. Small raised pearly or white spots on the nose, chin, and forehead can be present. These spots disappear spontaneously without treatment. Parents should not squeeze the spots. Mongolian spots. Spots of pigmentation that are blue, gray, brown, or black are commonly noted on the back and buttocks. These spots are more commonly present on newborns who have dark skin and can be linked to genetics. Be sure the parents are aware of Mongolian spots and document location and presence. Telangiectatic nevi, or stork bites, are flat pink or red marks that easily blanch and are found on the back of the neck, nose, upper eyelids, and middle of the forehead. They usually fade by the second year of life. Nevus flammeus is port wine stain, is a capillary angioma below the surface of the skin that is purple or red, varies in size and shape, is commonly seen on the face, and does not blanch or disappear. Arrhythmia toxicum, which is arrhythmia neonatorum, is a pink rash that appears suddenly anywhere on the body of a term newborn during the first 3 weeks. This is frequently referred to as a newborn rash. No treatment is required. The head. Head should be 2 to 3 centimeters larger than chest circumference. If the head circumference is greater or equal to 4 centimeters larger than the chest circumference, this can be an indication of hydrocephalus, which is excessive cerebral fluid within the brain cavity surrounding the brain. If the head circumference is less than or equal to 32 centimeters, this can be an indication of microcephaly, abnormally small head. Anterior fontanelle should be palpable and approximately 5 centimeters on average and diamond-shaped. Posterior fontanelle is smaller and triangular-shaped. Fontanelle should be soft and flat. Fontanelles can bulge when the newborn cries, coughs, or vomits, but should be flat when the newborn is quiet. Bulging fontanelles at rest can indicate increased intracranial pressure, infection, or hemorrhage. Depressed fontanelles can indicate dehydration. Sutures should be palpable, separated, and can be overlapping or molding, a normal occurrence resulting from head compression during labor. Caput succedaneum is localized swelling of the soft tissues of the scalp caused by pressure on the head during labor. Is an expected finding that can be palpated as a soft edematous mass and can cross over the suture line. Caput succedaneum usually resolves in 3 to 4 days and does not require treatment. Cephalohematoma is a collection of blood between the periosteum and the skull bone that it covers. It does not cross the suture line. It results from trauma during birth, such as pressure of the fetal head against the maternal pelvis and a prolonged difficult labor or forceps delivery. It appears in the first 1 to 2 days after birth and resolves in 2 to 8 weeks. Eyes. Assess eyes for symmetry and size and shape. Each eye from the inner to outer canthus and the space between the eyes should equal 1/3 the distance across both eyes to rule out chromosomal abnormalities such as Down syndrome. Lacrimal glands are immature with minimal or no tears. Subconjunctival hemorrhages can result from pressure during birth. Pupillary and red reflex are present. Eyeball movement will demonstrate random jerky movements. Ears. When examining the placement of ears, draw an imaginary line through the inner to the outer canthus of the newborn's eye. The line should be even with the top notch of the newborn's ear where the ear meets the scalp. Ears that are low set can indicate a chromosome abnormality such as Down syndrome or a kidney disorder. Cartilage should be firm and well formed. Lack of cartilage indicates prematurity. The newborn should respond to voices and other sounds. Inspect ear for skin tags. Nose. The nose should be midline, flat, and broad with lack of a bridge. Some mucus should be present, but with no drainage. Newborns are obligate nose breathers and do not develop the response of opening the mouth with a nasal obstruction until 3 weeks after birth. Therefore, a nasal blockage can result in flaring of the nares, cyanosis, and asphyxia. Newborn squeeze to clear nasal passages. Newborns sneeze to clear nasal passages. Mouth. Assess for palate closure and strength of sucking. Lip movements should be symmetrical. Saliva should be scant. Excessive saliva can indicate a tracheoesophageal fistula. Epstein's pearls, which are small whitish yellow cysts found on the gums at the junction of the soft and hard palates, are expected findings. They result from the accumulation of epithelial cells that disappear a few weeks after birth. Tongue should move freely, be symmetrical in shape, and not protrude. A protruding tongue can be an indication of Down syndrome. Soft and hard palate should be intact. Gray-white patches on the tongue and gums can indicate thrush, a fungal infection caused by Candida albicans, sometimes acquired from the mother's vaginal secretions. Neck. Neck should be short, thick, surrounded by skin folds, and exhibit no webbing. Neck should move freely from side to side and up and down. Absence of head control can indicate prematurity or Down syndrome. Chest. Chest should be barrel-shaped. Respirations are primarily diaphragmatic. Clavicles should be intact. Retractions should be absent. Nipples should be prominent, well-formed, and symmetrical. And breast nodules can be 3 to 10 millimeters. Abdomen. Umbilical cord should be odorless and exhibit no intestinal structures. Abdomen should be round, dome-shaped, and non-distended. Bowel sounds should be present with a few minutes following birth. Anogenital. Anus should be present, patent, and not covered by a membrane. Meconium should be passed within 24 to 48 hours after birth. Genitalia of a male newborn should include rugae on the scrotum. Testes should be present in the scrotum. Male urinary meatus should be located at penile tip. Genitalia of a female should include labia majora covering the labia minora, clitoris, and are usually edematous. Vaginal blood-tinged discharge can occur in female newborns, which is caused by maternal pregnancy hormones. This is an expected finding. A hymenal tag should be present. Urine should be passed within 24 hours after birth. Uric acid crystals will produce a rust color in the urine in first couple of days of life. Extremities. Assess for full range symmetry of motion and spontaneous movements. Extremities should be flexed. Assess for bowed-legged and flat feet, which should be present because lateral muscles are more developed than the medial muscles. No click should be heard when abducting the hips. Gluteal folds should be symmetrical. Soles should be well lined over 2/3 of the feet. Nail beds should be pink and with no extra digits present. Spine should be straight, flat, midline, and easily flexed. Reflexes. Sucking and rooting reflex. Expected finding. Elicit by stroking the cheek or edge of mouth. Newborn turns the head towards the side that the touched and starts to suck. Expected age. Usually disappears after 3 to 4 months but can persist up to 1 year. Palmar grasp. Expected finding. Elicit by placing examiner's finger in palm of newborn's hand. The newborn's fingers curl around the examiner's fingers. Expected age. Lessens by 3 to 4 months. Plantar grasp. Expected finding. Elicit by placing examiner's finger at base of newborn's toes. The newborn responds by curling toes downward. The expected age is birth to 8 months. Moro reflex. Expected finding. Elicit by allowing the head and trunk of the newborn in a semi-sitting position to fall backwards to an angle of at least 30 degrees. The newborn will symmetrically extend and then abduct the arms at the elbow and fingers spread to form a C. Expected age. Complete response can be seen until 8 weeks. Body jerk only until 8 to 8 weeks and 18 weeks, and then absent by 6 months. Tonic neck reflex. This is the fencer position. Expected finding. With newborns in supine neutral position, examiner turns newborn's head quickly to one side. The newborn's arm and leg on that side extend, and opposing arm and leg reflex. This is from birth to 3 to 4 months. Babinski reflex. Expected finding. Elicit by stroking outer edge of sole of the foot, moving up toes upward. Toes will fan upward and out. Expected age is birth to 1 year. Stepping. Expected finding. Elicit by holding the newborn upright with feet touching a flat surface. The newborn responds but with stepping movements. This is from birth to 4 weeks. Senses. Vision. The newborn should be able to focus on objects 8 to 12 inches away from face. This is approximately the distance from the mother's face when the newborn is breastfeeding. The eyes are sensitive to light, so newborns prefer dim lighting. Pupils are reactive to light, and the blink reflex is easily stimulated. The newborn can track high-contrast objects and prefers black and white patterns. Term newborns can see objects as far as 2.5 feet within 2 to 3 months, and they can discriminate colors. Hearing is similar to that of an adult once the amniotic fluid drains from the ears. Newborns exhibit selective listening to familiar voices and rhythms of intrauterine life. The newborn turns toward the general direction of a sound. Touch. Newborns should respond to tactile messages of pain and touch. The mouth, hands, and soles of the feet are in the areas most sensitive to the touch of the newborn. Taste. Newborns can taste and prefer sweet to salty, sour, or bitter. Smell. Newborns have a highly developed sense of smell, prefer sweet smells, and can recognize the mother's smell. Habitation. This is a protective mechanism whereby the newborn becomes accustomed to environmental stimuli. Response to a constant or repetitive stimulus is decreased. This allows the newborn to select stimuli that promotes continued learning and avoiding overload. Provide education to the parent and family about the neonate's appearance and give reassurance about extended findings that the family can be concerned about. Milia Epstein pearls caput succindium. Pain assessment. Measure newborn's pain using a combination of behavioral observation and physiological findings. Several pain scales can have been developed as a tool to measure newborn pain. Cry scale and neonatal infant pain scale, or NIPS. Behavior responses to pain. Alterations in sleep-wake cycles, feedings or activity, fussiness or irritability, limb withdrawal, thrashing or fist clenching, muscle rigidity or flaccidity, facial grimacing, chin quivering, furrowed brow, tightly closed eyes, open, square-shaped mouth, crying, groaning, or whimpering vocalizations. Physiologic responses to pain. Vital signs. Rapid or shallow respirations, decreased oxygen saturation, increased heart rate and blood pressure. Skin. Pallor or flushing, palmar or general diaphoresis. Laboratory findings. Hyperglycemia, decreased pH, increased blood corticosteroid levels. Other. Increased muscle tone, decreased vaginal nerve tone, increased intracranial pressure, and dilated pupils. Diagnostic and therapeutic procedures following birth. Cord blood is collected at birth. Laboratory tests are conducted to determine ABO blood type and Rh status if the parent's blood type is O or they are Rh negative. A CBC can be done by a capillary stick to reevaluate for anemia, polycythemia, infection, or clotting problems. Blood glucose levels are usually evaluated only in newborns who have high risk factors for hypoglycemia. Expected lab values. HGB is 14 to 24. Platelets is 150,000 to 300,000. HCT is 44 to 64%. Glucose is greater than 40 to 45. RBC is 4.8 times 10 to the 6th to 7.1 times 10 to the 6th. Bilirubin, 24 hours is 2 to 6, 48 hours is 6 to 7, and 3 to 5 days is 4 to 6. And white blood count is 9,000 to 30,000. Complications. Airway obstruction related to mucus. Nursing actions. Suction mouth and then nose with a bulb syringe. Mouth should be suctioned first to prevent aspiration as the nose is suctioned. Hypothermia. Monitor auxiliary temperature. Healthy newborn temperature averages is 98.6 with a range of 97.7 to 99.5. If temperature is unstable, place the newborn in a radiant warmer and maintain skin temperature at approximately 97.7. Ideal method for promoting warmth and maintaining neonate's body temperature for a stable newborn is early skin-to-skin contact with parent. If the infant does not remain skin-to-skin with parent during the first 1 to 2 hours after birth, place the thoroughly dried infant under a radiant warmer or in a warm incubator until body temperature stabilizes. Assess auxiliary temperature every hour until stable. All exams and assessments should be performed while the newborn is under a radiant warmer or during skin-to-skin contact with the parent. Inadequate oxygen supply is related to obstructive airway, poorly functioning cardiopulmonary system, or hypothermia. Nursing actions. Monitor respirations and for indication of cyanosis. This is to change in skin mucous membrane color. Stabilize the body temperature or clear airway as indicated. Administer oxygen, and if needed, prepare for resuscitation.